Hello everyone, I'm Dr. Srikanth Reddy. I'm a surgical oncologist. Today I would like to tell you how I generally prepare before editing any of my surgical videos. As you can see in the screen, this is the template which I created on Notion. Notion is the app which I use for my productivity works. So before planning for any surgical video editing, I try to make up all the details which I need in this format. So these are the headings which can be common for most of all the surgical videos, but as and then I customize it. These are the headings, and coming to the timings, based on why I'm editing the video, whether is it for YouTube purpose or for any conference, based on the time limit given in the conference for the any award presentations and all, I try to time individual steps. Then this is the description which I write down so that it can help me in the process of editing, and these are the things which I need. For example, whenever I need a biopsy, I see that I have the biopsy specimen or any clinical picture if I need. I try to keep them ready before I actually start the process of video editing. So coming to the headings, generally I write the name of the procedure, name of the patient, and when I perform. These are for my personal information, and the purpose of recording, I make a note of it, and I give a brief introduction which I can use while recording the video. This is the area where I write down the script which I can just read out when the video is being played, and it also helps me in noting down the things which I require. For example, this was a right hemicolectomy video which I was planning to edit, so I try to capture the colonoscopy picture and biopsy picture, and when I'm talking about radiological imaging or any other important investigations, I try to keep these things ready before I start the process of editing. And coming to the surgical procedure as such, every video or every surgery I perform, I try to record a few important things like the patient positioning and the port positioning. If I need them, they will be useful on a later date. And coming to the surgical steps, every surgery I try to break down into a few different steps. For example, we in our institute follow the cordocranial approach of right hemicolectomy. So these are the important steps which I would like my viewers to see. So I write down the important steps so that I can actually concentrate and time those steps properly. And under each step, this toggle button, if I press, I can have the script which I want to tell, or if there is any important point which I want to define for the viewers at that specific step, I can make a note of it so that I don't miss that point. By making your surgery into different steps, you can time them properly and you can finish the video editing in that specific time frame. And once all the surgery is done, never ever forget to take the surgical specimen picture. So this is you can keep it ready before you start the process of editing. And then conclusion. So this is the template which I generally use for all my cases, and I will post this template in Notion platform. If you are interested, you can download it and use it for your editing. Hope this video is useful for you. Thank you.